13 months ago. I was riding a bicycle and my shoe got caught in the pedal and I severely sprained my foot, my ankle, and my lower leg. And a few months later I started physical therapy somewhere else in Long Island, and I wasn't happy with them, and a neighbor recommended that I come to the physical therapy doctor. With the traditional therapy, although there was improvement about 40%, and it was stagnating there, the problem was really the severe tendonitis and the pain in the ankle, in the lower leg. That prevented me from doing practically any kind of movement would cause that to flare up. Right after the injury, I was on crutches and I could not put any weight on my foot whatsoever. Then the doctor switched me over to a surgical shoe, but it was still extremely painful in my foot, my ankle. I could walk, but with very limited amount of time, and I couldn't stand. And it was extremely painful and becoming more so as the tendonitis was developing in my lower leg. So after maybe walking 100 feet or standing for maybe 3 minutes, the pain was just so bad that I would have to sit down, elevate my leg, and put ice on it when I was at home. When I was walking or standing, the pain was pretty much excruciating. When the tendonitis developed, the long-lasting pain was the tendonitis, which had become more and more severe. And it was very frustrating for the physical therapy and therapist and for me, because it seemed like there was improvement in certain parts of where the injury occurred. The tendonitis was causing very, very bad pain. An example is that I had just gone to dinner with about 10 friends, and we were sitting in a restaurant, and I wasn't even standing, but just not being able to move my leg, I felt like my calf seized up. The pain was so bad. And it was very shortly after that when I would come to the physical therapy. Robert had suggested that, asked me if I wanted to try a different type of physical therapy that would concentrate on pain management. And I'm very open-minded. It sounded a little weird, but I said, why not? I was willing to do anything. He went away about 95%. And like not within maybe a week. He went away about 95%. And like not within maybe a week. All the pain that was preventing me from walking, standing, walking upstairs, downstairs. Now I can do that a little guarded, but there's no pain anymore. The pain was really the thing that was holding me back on everything. The pain was so severe from the tendonitis that the exercise program that the physical therapist had prescribed to strengthen the muscles in my ankle were so difficult for me to do that I would often just come in and say, I can't do the exercises, the pain is so bad. And so she'd have to give me steam and heat and then do the manual massage. Since the pain is gone, I'm really able to do all the exercises, and I feel I'm making a lot more progress on strengthening the muscles because the pain is now eliminated. So I would really highly recommend that people that are not getting the success that they would want with traditional physical therapy, although that does help, for pain management, I just found this to be almost like a miracle. And it's something that I would absolutely recommend. In fact, I have.